Basically, it's the cells in the breast. The breast has cells. You have fats, you have ducts and lobules. So if the cells in the breast, a group of cells decide that, okay, now we are not going to follow the normal regulation, then they outgrow themselves. Everything that has a beginning must have an end.
Yeah.
So the cells in cancer basically refuse to have an end.
So just keep.
So they keep multiplying.
Multiplying.
The body is supposed to regulate everything, including red blood cells. They all die, and then new ones are born. So that's how we age.
Yeah.
Some die, the skin changes,
yeah.
every part, every cell in the body has to die. So in cancer, they just refuse to die.
So that's how they become cancerous, essentially. That
They're growing
keep
out of
growing.
control. And then they grow to the extent that they leave the organ they start in breast cancer. They start in the breast and then they eventually grow out of the breast and go to the other parts of the body. So it's just when there's no regulation, there's a team of cells saying, okay, you need to gluten. There's no control over here. We're going to do what we're going to do. Yeah, right.
Dang, that's crazy. So I wanted to know, are there any specific risk factors that people should know about, if it's genetics, lifestyle, etc.?
So basically, we still don't know the exact cause of breast cancer. That's the other problem. So we don't know, we don't have a vaccine yet or anything. So we talk about risk factors. We talk about those that you can do something about and those you cannot do much about. So the modifiable and the non-modifiable risk factors.
Okay.
So modifiable would be something that you can change, things that you can alter. Let's say smoking. Yeah, you can stop smoking. Alcohol, that's another modifiable risk factor. Exercise. That's
I'm looking at them. Yeah, you are hearing her. Continue.
Yeah, so diet, exercise, smoking, alcohol. Those are things that you can do something. And also having your child earlier.
Baku.
You see us?
Yeah.
So I have a question. When you say smoking, does vaping, is it vaping or vaping?
Vaping.
Vaping classify?
Yes, it does.
It's
Because
smoke.
it's part of it.
That one is nicotine, and I don't even know what else they be
You don't
mixing
even.
there.
I'm telling
I
you,
don't
we're
be
just
buying that.
inhaling and exhaling that smoke.
Okay.
It's all part of smoking.
That's interesting.
Yeah. So the modifiable things are the ones we target with advocacy. We're like, okay, let's change these things, and then we can do something. So we know that breastfeeding can provide some sort of protection. Like women that breastfeed lower their risk of getting breast cancer. Also, women that get pregnant earlier. Like 20, we're not talking about early marriage, but this is 2025. Early marriage is now 20, 21, 22, 23.
Facts. You'll be like, teen marriage. This is a child bride, and it's a whole 25-year-old.
Right.
So I do understand.
So things have changed a lot from what we used to know as early marriage. When I talk to patients, I say, try and get married early, and the patient is like 28 years old. Try and get good. So it's
At that point,
Gang.
At that point,
so
it's not I man. I mean, she.
So the advantage of getting your child early or getting married or getting a child earlier is that
linked to the
you
breastfeeding.
can basically, not just that, you can also get your children earlier. Let's say if you're going to get breast cancer at 32 and you already have 3 kids. That's a big advantage for you. Considering, let's say if you're 32 and you're newly diagnosed with breast cancer, you're not married, no child.
So you better adopt.
So she's saying now, like, was women, older women basically are at a high risk of getting cancer.
Yes, all cancers.
So
The
what do
older
you,
get.
when you say older, like,
What's the age range?
Where do we draw the
What's the
line?
minimum age
We want to know, like,
that
when you say
counts as older?
The thing is, all over the world, women, the other countries are talking about women starting screening at 40, at 50. In the Gambia, we are seeing 25-year-olds getting breast cancer. So our reality is a bit different.
It's a bit different,
And we need to start speaking and acting differently. Initially, when a 23-year-old, when I was going to medical school, when a 23-year-old presents with a lump, we were like, okay, it's benign. It's nothing.
Oh, she's just 23,
Yeah, 23. They like, because usually the lumps that present in younger women are not cancerous. So you're like, okay, it's a child, but now we are not doing that anymore.
You can't take that
lump
risk.
is a lump.
The
you gotta look
message
into it.
is every lump should be checked by a healthcare worker. And then it's not just to do a physical examination. Is to go and do the second and third stage, meaning you do ultrasound, you do a fine needle aspiration, meaning we go take a needle, put it in the breast, in the lump, it doesn't hurt that much.
I felt
Just
kind
inside the lump,
felt
and
the
just
chill.
take a tissue out and confirm if it's cancer or not.
Okay.
So every lump should be checked.
Should be checked.
Except the little exceptions, of course, are like breast when you have abscesses. So when the healthcare worker sees it, usually they know it's an abscess. They drain, give antibiotics, and then it goes away. So those ones are usually easily treated. Those are not the issues. It's those lumps that are not affected, associated with maybe fever or any accumulation of. Yeah. So.
Okay. Oh, sorry. I have a question. How has the advocacy been in the rural Gambia? And also, what would you say is the best age as a woman or even a guy to go and check for, like, do the screening and all that?
Yeah. So rural Gambia, I think we recognize that those that are in this region are doing better. Like the awareness, everybody is shouting around this end, and then over there we're leaving those women that have maybe not gone through formal education. We're leaving them behind. So that's part of the mission of our foundation, to go and reach out to those ones and say, these are the signs and symptoms of breast cancer. These are the risk factors you need to look out for, and this is what you need to do to screen. So in those efforts this year, we were able to go throughout the country and teach healthcare workers. We cannot teach all the women, but the healthcare workers, the centers they go through, we don't want a healthcare worker to see a patient with a breast symptom and then they dismiss it off as something that's benign. So we were able to train up to 290 healthcare workers all over the country. That helps. It helps. It's not the only solution, but it does help a lot. And we have seen that some of them still call and say, I have this patient, what should I do? Can I refer to? And we're like, yes, go ahead and refer to the clinic. So it did help, and it's a step forward.
So, like, how often should a person, let's say the woman or the man, go for screening?
She did ask about the age, and like I said, we have a different reality. And we cannot say wait till 40 and start screening. That's haram.
That's late. That's late.
That's late.
That would be
Whatever is
illegal.
happening, the cancer would already
So in advanced countries, they're actually starting at 40, 50 to screen. But us, I think we need to start a lot earlier. Like as long as the girl is a teenager, 16, 17, we need to start
be on the safer side.
At least let her know how to do a self-breast examination.
Okay. So I feel like you often hear people say it doesn't run in my family. How true is that? That they're safe?
The thing is, in a setting, somebody can have something and nobody in the family knows that. It's even improving now and with the awareness, but somebody can literally die of a disease and the family members, they don't know. Even the escorts that take the patient to the hospital, you ask them, they're like, we don't it's know. Now that it's changing a bit. So to say that I don't have family history of breast cancer, that would be a very bold statement. So what you say is I don't have any known family history of breast cancer.
You don't even know.
You really don't know.
So you're
because
thinking
I feel like
everything is okay.
The problem here is that, at least what I've seen, is that not everybody goes to do like a yearly physical. So you won't even be able to see itself. Is when you realize, oh, actually, I feel like crap, for example, and let me go to then that's where they tell you, you have hypertension, diabetes.
Because most of the time you're just going to check for malaria. That's the only thing you're going to do.
That's the only thing. So they don't actually go to just do a full physical, the blood count, all of that
stuff. I think Maria got somewhat lucky. Like people now are not even checking. They're just going and starting the quantum, diagnosing themselves and just going ahead.
They've made it easier for us now.
I feel like we want ChatGPT.
We have been to, I feel like malaria and Gambians, we have been like this since
5 and 6.
Since chloroquine days. So we know how to treat it now. You have slight, you say malaria.
It's
most of the time it's 100%. As soon as you go to the pharmacy, you know like malaria, wait for a minute. No. So you start prescribing, you start drinking all these things. So boom, mom. If they were nursing school, we have it locked in with that. To be honest.
So we were talking about like the early detection and then the minimum age and stuff. So I wanted to know, like, how early, like when you're doing like the check, how early can it be detected, and then what are the chances of recovery, like once you find it early?
So you can have a lump and not be able to palpate it. Sometimes if it's so small, it's starting. But with cancer, it's going to grow. It's not going to stay. If it was staying small, it's okay. It will stay like it, but it would grow. So when it grows, that's when you are able to palpate it. It has to get to a certain centimeter, because if it's starting,
This, like
it's
this.
just gonna be tiny. You're gonna
Yeah.
think that it's part of
Yeah,
the breast.
Interesting.
So the unfortunate bit is it's usually not painful. So we are praying to the Lord to make breast lumps painful, so everybody can just rush.
Just go, yeah.
Right.
That's true.
I wish it was painful,
I do
agree
because
with you.
early
Because
diagnosis
like,
would
yeah,
have
it would
been
you
a
just be
thing.
like, oh, okay, like this is a
Yeah,
lump.
just-
Oh, yeah. Like it's
Because
not
you made
going
to
to...
chuckle knee sometimes. You don't
Thank
understand
you, and that's
that
what I'm
it's-
saying.
Yeah.
Because people will wait until they're in a lot of pain, then they go. That, like I said, that's when you go and discover you had 10,000 things
That's
going
the
on
time
in
I
your
drag myself
blood.
to the hospital.
Since this episode is more of awareness raising, you made mention of something like ultrasound, biopsy.
Oh yeah, I was even
PE,
about
and
to ask.
So I
like,
just
what
wanted to
screening
confirm:
methods
is there
exist.
any difference between the mammogram? Is it mammogram?
Mammogram, yeah.
Ultrasound and biopsy. Like, what is the difference?
Yeah. So biopsy is the histopathology. That's lab.
Okay.
Yeah. So you have radiology and then you have lab.
Okay.
So you have to do radiology and you have to do lab. It's different. So it's a clinical breast examination, which is usually done by a healthcare worker, and then radiology, which is either ultrasound or MRI or mammograph, and then histopathology is the definitive. It's almost 100%. If they say is this, that's it.
Okay.
Interesting.
get
So
it.
yeah.
Thank
So
you.
here in Gambia, what are the screening methods that exist? Like, for example, the mammograms, the clinical exams or whatever. Like, not only that, but also like, I guess I've seen a lot of like self exams and things like that. So what screening methods would you I guess suggest, and what are actually available like here?
Okay, so because we are low, and I don't know if I should add it, middle, but we're part of the low and middle income countries. It would be crazy to say everybody should use a mammogram, because
That'd
we
be crazy.
cannot
We cannot
afford
do that.
We don't even have enough mammograms for that. So we only request the mammograms to special groups, like you're maybe above 40 and you have a family history, and then we want to really go, because the mammogram can see what like more specific details than what the ultrasound can see. But for usually the general population, it's ultrasound. You do a clinical breast exam, because the clinical breast exams also tells you, it gives you a clue. For experienced doctors like Dr. Jaite, he can just have a strong clinical suspicion that this is likely, especially in advanced cases. That one, mom.
As soon as you see, you know.
Yeah, you can have a strong clinical suspicion, and that this is malignant.
This is what's going. Okay. So we did ask how often they should get screened. So would that also, like, if, for example, for me, if I'm going to do my physical like once a year, would that be a good amount, like once a year for me to go?
So once a year for a
screened?
healthcare worker to screen you, that's great.
Yeah.
But for individuals, you can do the self-breast examination,
Oh,
which
so
we advise.
How do
monthly.
I know they're going to ask.
It's
How do we
monthly.
do it? I can show a demo. I don't mind.
So
We talk about
usually,
movies.
the recommendation is to do it at least once a month.
At least once a month. Okay.
Yes. So that you can have a good idea what your breasts feel like.
So how do you do it? Do you just...
So basically, you start one breast at a time. You
Okay.
need to,
One at a time.
preferably, you can start with inspection. You stand in front of a
the
mirror.
Okay.
Yes, with your hands down.
You heard them.
And,
First step, mirror. Check.
Yes. So you check, and what you're looking for is hands down first, and then later you can raise your hands to see.
Oh,
So you just stand first and look at the skin of the breast.
Okay.
Start with the skin. Look for any changes in the skin.
Changes. Okay.
Are you seeing patches of
patches.
yes?
Sagginess.
It's like
and so like
First of all, the sagginess is gravity. Okay, the skin.
Yeah,
Okay,
the skin
to check so that nothing is
discoloration.
off.
Yeah, so sometimes we call the skin pure orange.
Okay.
Meaning it looks like the back of an orange peel, like those. You know, the skin already has.
Interesting. Yeah. Has
So it goes in deeper with breast cancer.
Okay.
Yeah, so it has the skin looks like it comes from French pure orange.
Yeah.
Is that part of the nipple, like the breast that is black?
like that. Yeah, that is
It's the skin itself.
Just the skin itself.
The breast skin itself has already has pores. So those pores will go in deeper.
more visible.
And then it would look like the orange. When when you look at the orange cover,
For the cover, how it
especially
looks,
the orange, the imported orange. Yeah, so you can see that the pores are more visible. Yeah, so you look for that. You look for skin changes, any discoloration in the skin. You look for visible lumps. Sometimes you can see a bump in the breast.
Okay.
Yeah, hopefully not, because usually it's usually a big lump.
Yeah.
And then you can raise your hands and also see. Sometimes skin puckering, like some part of the skin is going in, and then you can look at the nipple. So you look at the nipple area. That's the dark part of the breast. Yes, you check for any nipple inversion.
Yeah.
Is your nipple out or in?